This presentation will quickly go through an efficient and safe way to set up for a patient care task. The task may be any bedside procedure that a nurse might do, such as trach care, insertion of an NG tube, wound care, administration of IV medications, and many others. It's well worth your time to make sure prior to performing a task that you have all the items you will need to complete the task before performing that task. Performing the task is your focus, but think about the moments prior to that task and after the procedure is completed. Does the patient need pain management or sedation before the procedure? Does the patient need non-pharmaceutical interventions, perhaps a visual distraction, diversion such as looking at TV or a book, or maybe playing music or holding someone's hand? Ask the patient what they know works best for them and mobilize the support before the task. Then, during the task, what if the patient has too much pain or vomits, or has a reaction to a medication that's being administered? In my book, 3-Question Method for Clinical Preparation for Nursing Students, I talk about how important it is to be prepared for the worst thing that might happen and how you would respond to that if it were to happen. How about after the procedure? Cleanup is important, including getting rid of old dressings or any offensive items that might have an odor or be visually unpleasing. Emotional support is important for the patient before, during, and after a procedure. Don't be shy in mobilizing support. A chaplain, a family member, activity coordinator, or a child life specialist, or even a volunteer. Find out what is available where you work. The first step is to gather all the supplies that you will need. Think about the steps involved in the task you're going to do and gather all the supplies you expect to use. It never hurts to have extra alcohol pads and gauze. Second step is to prepare the work surface you will use. Prepare the work surface following your institutional guidelines. This may require a 3 to 5 minute dry time for disinfectant that you must use. To save time, consider cleaning the work surface before collecting your supplies. After the disinfectant is completely dry, cover the work surface with a towel, waterproof pad, or a sterile drape, depending on the task and institutional guidelines. The third step is to lay out the supplies that will be used in the order that each item will be needed. Think through the steps of the task. Carefully lay out the items you will be using in the order each item will be used. Here is the layout for a simple dressing change on a wound. I have adhesive remover to remove the old dressing and for the tape. I have gauze pads to use with wound cleanser to wipe the wound and the skin surrounding the wound. I have extra gauze pads to wipe in the wound. I have Cavalon no-sting barrier film, which is a great product to put out on the edges of the wound and the skin that's around the wound to protect it from excessive moisture and also to protect it from adhesive tape. And then the primary dressing, in this case it's a silver dressing, and then tape. If you are teaching a patient or their caregiver how to perform the task, after you lay out the items, ask them if they want to take a picture of the layout with their mobile phone. Many times I've had a caregiver ask if they could take a video of the steps in the procedure. As a wound care nurse, I saw the importance of that, but follow your institutional guidelines. Talk about each step and the purpose behind it so the caregiver knows the reason for the steps. They may be less likely to forget a step if they know the rationale. Encourage the patient and/or the caregiver to engage in the task as they learn the steps. Think about using the see one, do one, teach one method. First, the caregiver will see you perform the task. Then they will participate until competent. Finally, they will need to teach a second caregiver or teach back to you, the nurse. That will solidify the steps of the procedure for them and give them confidence that they can do the task. I've taught parents how to pack deep tunneling wounds in their children before. Taking the steps slowly and encouraging them on the way leads to the greatest success. Make sure that you move the trash can nearby to drop waste into as you lay out the items or perform the task. You may want to have a small receptacle, such as emesis basin, on the table to collect trash, such as alcohol pads, packages, or syringe caps. Losing a syringe cap or other small cap in a bed can cause injury to the patient, and a child could actually try to eat it and choke on it. Have a separate receptacle for items that will go into a sharps container after the task is completed. As you lay the items for the task out onto the table, note any missing supplies and get them before starting the procedure. The fourth step, perform the task. Start the task working from the direction from which you chose to lay out the supplies. This helps you to remember each step for the task. The fifth step, when done, clean up and return the work surface to its place. Dispose of trash and sharps appropriately according to institutional policy. Okay, let's wrap up this presentation. Remember, set up your supplies in a way you will use them. Keep it neat. Dispose of items as you go along by keeping the trash can close and a basin for sharps on the table rather than scattering them all over the workspace. Review the procedure for the task in your mind before starting, making sure you have all the supplies you will need. Ask your patient if they want you to tell them what you're doing. Some want that information, others do not. Be prepared to have someone distract the patient while you concentrate on getting the task done as safely and as quickly as possible.